Hi everyone, I'm Suzanne Sysko Clough. I'm the Chief Medical Officer here at ArmadaHealth. I'm an endocrinologist by training, but as the CMO of Armada, I get to lead and work with a team of physicians and data scientists and engineers in the building of our physician recommendation engine. So there are a lot of problems in healthcare today, but the one I think that just isn't getting enough attention is people not getting to the right doctor. And the consequences are staggering. You know, what we're seeing is that 12 million people a year are getting a wrong diagnosis. 20% are receiving treatment they don't need. Half of people every year are getting the wrong treatment plan. And there's costs to this, real costs. There's an estimated $700 billion of preventable waste in the healthcare system. So ArmadaHealth is a healthcare technology and services company. We've been around for over a decade. We're founded by some of the country's leading physicians. And really our main mission is to bring healthcare transparency to the masses. We truly believe that everybody has the right to access to the information that matters when it comes to selecting a physician for a unique medical condition. And so we have combined the best in class in data science, technology, in our clinical team and researchers in being able to do all that hard work so that consumers of healthcare don't have to. They just have to trust that ArmadaHealth is their go-to resource for understanding who the right physician is for them. Let's talk health plan directories, right? I mean, most health plans are struggling even at the most basic level. Like legislation had to be introduced that said, listen, everybody, we have to figure out how to at least get practice location and phone number and physician specialty right. But as of about a year ago, we're still seeing about half of the directories have mistakes that actually prevent access to care. I mean, that's maddening, right? Talk about a bad experience. And so where I think directories could get so much better and smarter, I mean, think about it. Health plans, most of them have a lot of great physicians in their network. They just don't have the data about them, and/or they don't have the data presented to their members in a way that makes it really easy for the member to say, oh, that's who I should be seeing for my hip replacement. That kind of orthopedic surgeon, not the one that's specialized in the ankle. Because that's a real problem. Subspecialization in medicine today is real. Ophthalmology, the eyeball, there's 10 subspecialties. You know, who would think? Endocrinology, I'm an endocrinologist, but my focus was diabetes. If you had found me on a health plan directory, you would see endocrinology and most likely a list of conditions that are treated commonly by endocrinologists. I don't want to see pituitary or thyroid. That's not my thing. And if someone walked into my office, I would do the best I can for them and most likely would say, you probably want to go see that lady down the hall and get them to the thyroid specialist. But that kind of information about areas of clinical expertise or areas of clinical focus or what their true subspecialty is, that's missing in the provider directories. And just that enhancement in itself can make a world of difference to someone seeking care. ArmadaHealth is different. Listen, there is a lot of noise and hype out there with data transparency and quality programs, and I'll make it really simple. Anybody who's telling you that they're a big data solution, they have 5 billion data points, and that's all they need is lying to you. You know, I can go to these data-only sites, and you can go too. Look me up. And when you look me up, it looks like I'm the most amazing endocrinologist out there, despite the fact I haven't practiced in 15 years. And the reality behind that is that we all know that healthcare data is messy, and it requires not just the data, but the data scientists to make sense of it, the clinicians to help the data science make sense of it, to train, and the clinicians that are needed to train the data science models to look at the data science model outputs, it requires a ton of work. So these pop-up startups that, think that because they're getting 5 billion data points from CMS can all of a sudden be a thought leader in data quality, it's just not true. And then you also see others in the space that are relying solely on reputation. And we know that these centers of excellence reputations are getting diluted as we see trends like them lending their brand to affiliations. And so what Armada does is different. We take an approach that we like to call high-tech, right touch. So, yep, we get all that data as well, but we get data outside of just the administrative claims databases. We want to know more about just the 30, 60, 90-day post-op complications. We want to know more about who that physician is as a human. And so we go broad and deep into other data sources. We also have invested very heavily in our team of humans. This is this right touch on the internal side that are physicians, clinicians, researchers that help make sense of the data, that help create the algorithms and the rules, and then follow outcomes long term to see what happens. That's a difference too, the fact that we add that in there. And then last, we have these navigators that many of them have been doing this work for over 12 years. And they're able to get information from members or patients that you can only elicit from a conversation or that human touch. And those learnings that we gather from the navigators, we bring that back and put it back into our system. So this is again where this kind of right touch piece is so important. And then lastly, the patient, how did they do? What was their experience? Not just with us, but with the physician and the physician's office. We capture those patient-reported experience measures and put it back into our knowledge base. And we also capture their outcomes. How did you do clinically? 30 days, 60 days, a year later, tell us. And those patient-reported outcome measures have often been shown to demonstrate or correlate better with clinical outcomes than administrative claims database data. So we take all of this and bring it in through this high-tech, right-touch approach that I think differentiates us from the folks who are siloed in data only or AI only or reputation only. So I think that's why we're different. The human, right? We have our human navigators and researchers and credentialers who are there to do the work to find the answers when the data is sparse. And we all know healthcare data is a hot mess and it requires humans sometimes to sort through it at another level. But additionally, we rely on the human member, that human patient. What is it that you need and want and desire in your experience with a physician? And not only that, what happened? How was your experience? What were those patient-reported outcome measures? That's that kind of information and data that you get that you will never find in any claims database, but they are truly representative of good quality care or represent how good the quality of care was. So our mission at ArmadaHealth is to help as many people as possible. And to do that, we want to empower our partners as well as we can. And that looks different for different partners. Sometimes when folks want to partner with us, they want ArmadaHealth to deliver our entire solution end to end on behalf of our customer. Other times folks say, nope, we've already invested very heavily in our own care manager personnel or our own health IT infrastructure. We want to integrate with you this way, or we want to leverage your resources that way. Single sign-on or a website link directing us to a microsite. There's a variety of options that we have worked with partners in the past. Our goal is to make our partners as successful as possible. Our implementation teams, account management teams, they're awesome. Look, the goal is that we want to do the heavy lifting. We want to make this as easy as possible for our customers. So, we have an implementation playbook that covers everything from the type of integration. We have the marketing playbook. We have the member communication playbook. Any and all of this can be leveraged by our customers to make the deployment of this service as easy as possible. In 3 to 5 years, I would hope that consumers of healthcare would know that it's really not okay to ask social media who you should seek for your healthcare. It's just way too important. In 3 to 5 years, I would hope that the consumers of healthcare would understand that ArmadaHealth could be their one-stop shop for getting them to the right care for their unique condition. I mean, we have invested so much capital, from a human capital to actual dollars, to data acquisition, data science, clinical teams and insights and algorithms and our technologies to do all of that hard work to really sort through that messy healthcare data, so that the end result is it's an easy thing for anybody seeking care. They just come to us, whether it's online or they pick up the phone. If someone needs healthcare, think ArmadaHealth is what I'm hoping. And what we'll be able to do is use that information, not just about the physician, but about the member. What does that member need from a non-clinical perspective to make them feel like they found the right physician, whether it's gender or language or distance or any other sort of non-clinical preference? How do we take that information about this human member and this human doctor and find them the most suitable recommendations, so that all they have to do is make a choice? It's a no-brainer. Which one of these resonates more with you, and whatever that is, you can't go wrong. So yeah, in 3 to 5 years, I would hope that more people are understanding that this could mean life and death. Either not using a true validated source of information about who's going to be providing care for them.